So when we look at hormones, with women, we mostly think of estrogen and progesterone. Sometimes in conventional medicine, women are lucky enough to hear about their testosterone, maybe DHEA. But really, each of these hormones has at least, the dominant ones, I want to say at least 20 to 30 different functions in the body. And when you think, for a lot of women, it's as simple as saying that I'm just gaining weight. I haven't really changed much, but I'm really holding on to this weight. What changed? And they might talk to some people and people say, well, your hormones changed, just get ready. Yes, that is absolutely a factor, but I cannot stress enough. It is a factor. It is a small part of the big picture. And when you actually look at how many women are coming into perimenopause or into menopause with their hormones disrupted, with their testosterone level already near zero, and testosterone, it absolutely is libido, but you also are thinking of possible hair loss. You're thinking of possible fat retention, inability to lose weight. Same thing with estrogen. Estrogen really has a place in the body for so many different good things, but I'm seeing more and more women, we're seeing women here and kind of as a whole in functional medicine who have levels that are irregular starting from their teens, starting from their 20s, really going into their 40s, their 30s and 40s, setting themselves up for that lack of ebb and flow, and really for that kind of massive shift in hormones. So stress causes a progesterone deficiency. When we're thinking of your hormones, we're really thinking of, like I mentioned, estrogen, progesterone, testosterone. Progesterone is that chill pill. It's that hormone, it's that mellowness. It's what helps you sleep. It's what prevents that lack of anxiety. If you're thinking of women who have ever had PMS and the symptoms before their period, oftentimes they're very low in progesterone, which is what happens when you feel crazy and you feel mood swings and you feel like your sleep is disrupted and all of a sudden you get diarrhea before your period. What's really happening is your body's trying to signal, it might have been signaling for a long time, hey, I need more progesterone. That's why a lot of women get clots or they get a heavier period, is because their progesterone, that oftentimes now we already see as low, has actually gotten even more significantly low. And so you're not getting that feel-good kind of buffer. And so the rest of the body gets into more of a state of stress. So in menopause, these hormones drop. The biggest thing to take away is that just because they are changing and dropping does not mean that they cannot be nourished in a way that doesn't make it detrimental to your health. Because if they fall and it's sudden, or if they fall and they've already been so disbalanced, that's when brain health can be affected. That's when women say, I just don't think the way that I used to. Or frankly, they come to us and say that I don't even know where to start. It seems like everything kind of took a turn. So if you're thinking that if going back to the previous slide, if we already know that your brain is the one that's supposed to be sending the first signals to your reproductive system, and if it's getting those signals in a different way, then you can imagine that you're already set up for a massive disbalance with a lot of side effects kind of from the start. And that doesn't have to be the case.